So we chatting today with Deirdre Finn. She is a physical therapist with 25 years experience focusing on osteopathy and chronic pain and hands-on physical therapy.
Right.
What else would you like to tell us about yourself, Ms. Finn?
Well, I also work a lot with spinal issues and headaches. I would like to work with women's health, the pelvic floor, different kind like stress incontinence, all kinds of things like that. And I have a holistic focus, so I treat the person from head to toe. Everyone who comes in, I evaluate the whole body, listen to everything they have to say, take the person into account.
And that's really unusual these days when most of your medical appointments are rushed. You got a short amount of time. You're focusing on one thing, just the knee, not the hip and the ankle. So the fact that you can have the luxury of time with your patients, that's a huge, big deal.
Yeah, my sessions are an hour, and I can only work this way by working outside the insurance model. Yeah.
This is what I'm seeing a trend of here lately. Some of the PTs here in Portland, that's what they're going to. It's just not even messing with insurance.
Right. Like if you have a really simple problem, you can do really well in with a big PT clinic with a short session time. But for people that have longstanding problems or multiple layers of problems, you need the time, you need the experience, the focus. Yeah. Yeah.
And so we had been chatting on LinkedIn, and then I was glad you reached out to me this week because I'm starting a menopause course tonight. Actually, it's going to be 4 weeks long. And so I was so excited to talk to you today about pelvic floor health specifically and changes that you see in your patients going through menopause, say 40 and 50 and up.
Yes, it's such an important topic. I thought your course sounded so excellent. I feel like we really don't talk enough about these issues. We should be talking about them all the time, getting women ready for what's going to come, helping them through it, even on the other end. Yeah. So as soon as I feel like my patients are comfortable talking about the pelvic health, I start talking. And yeah.
Because one of the books I was reading, they described it as a reverse teenage years, right? You have your quinceanera, you have your celebration through, and then menopause, it's very secret. It's not a thing that's celebrated in our culture. We're changing that starting today.
So one thing I like to tell people is that the pelvic floor has structural functions. It helps to support you. It supports your organs. It helps to support your hip joints. When you stand on one leg, your pelvic floor contracts on that side to help stabilize your hip. Most people are more familiar with sexual function, reproductive function, excretory function, going to the bathroom, all of those things. But also the pelvic floor is a kind of like the bottom of the container of your abdominal cavity, of your abdomen. And it mirrors the diaphragm, we call the respiratory diaphragm. So a good image is if you think of a can of soup, the soup's contained in the can, and then you have the top of the can is like your diaphragm, and the bottom of the can is your pelvic floor or your pelvic diaphragm. And if you push down on the top, the bottom is going to bulge out. Or if you pull up on the bottom, the top is going to go up. There's a pressure inside the can, and then the top and the bottom are regulating that.
So it's a contained, pressurized system.
Exactly.
And then what typically can go wrong with that pressurized system? You mentioned pressure from the top going down and the bottom. I know a lot of my ladies talking about leaking urine when they laugh or jump, weak pelvic floor muscles, pain during sex, constipation.
Right. So there's a lot more forces pushing down than there are pulling up. Gravity, the weight of your organs, women that have had surgery, giving birth, coughing, even having a coughing fit, an attack of bronchitis can weaken your pelvic floor. So It's important to, when you think about strengthening it and pulling up, is to include your diaphragm in the equation. If, for example, you had a surgery or you had a respiratory illness, bronchitis, COVID, or whatever, you might have tension in your diaphragm. That tightness can help push down on your pelvic floor. Another thing that pushes down is doing exercises in a way that bears down. Like any bearing down pushes the pelvic floor down. So that's why it's very important to start, when you start any kind of pelvic floor exercises, you make sure that there's room in the abdomen, that the diaphragm is flexible, that the organs are mobile, that the breath is good. And then how do you exhale in a way that pulls the abdomen in and lifts up, and taking pressure off the pelvic floor from the first breath that you're working with it. That's why just doing Kegels is not enough. You have to sort of address the whole abdomen and the mechanism.
So you want that soft tissue to be free and mobile. You want the diaphragm to be able to act kind of like a jellyfish or a trampoline going up and down. Mm-hmm. And I think we think of Kegels a lot just because that's probably what people have heard of. Now, that it's true that you can do too much tightening of your pelvic floor, right?
Mm-hmm. That's true also. And there's also kind of some women, their pelvic floor is too tight. That can happen after an injury also, a hip surgery, even giving birth. It can be a reaction to giving birth. The pelvic floor muscles actually, sometimes when they tighten, they just don't let go. And it's sort of like holding your breath. So really, you want to think of all the muscles in your body are like a sponge. You want them to be able to contract and expand. That's their function. Contract and expand, and they have to go both ways. So if you're not sure what's happening, that's the time actually to go to a pelvic floor therapist, a physical therapist, see which direction you think you might go in if you're not sure.
Because this is just like training a squat or a push-up. You might need some coaching as to proper form, how to breathe, how to tighten and release your pelvic floor.
Yeah, and I think like some indications that you need some coaching, you need someone to look at you, would be urinary incontinence, like starting to leak, like feeling like you have to go to the bathroom all the time. That's another good one. Or just feeling like kind of like chronically heavy and achy in your pelvic floor, genital area. Like could be pressure. If you feel pressure, if you feel uncomfortable when you go to the bathroom or when you cough, all of those things mean that it might seem like something you can ignore, but actually it's good to be proactive and preventative. The sooner that you start looking into that, the better. Yeah.
Because as we age, our tissues do become less elastic, just like the skin on our face. And so there's some of this that is just the natural process of aging, but then getting at this before it gets to the point of, say, you've got a prolapsed uterus or a bladder, right? Can you do a little work once you first start to notice those things going wrong?
Right. If you start addressing them soon, or for example, soon after childbirth, even though you may be completely overwhelmed, it's important to just do 5 minutes a day. Just a little bit can be helpful. Yeah. And then the changes of menopause, it's almost like, don't get me started.
Tell me what I have to look forward to.
Yeah. I mean, it's kind of sad in a way that you could be doing everything perfectly right, but once the hormones change, your body tissues change, right? And the natural lubrication in the vagina is going to dry up somewhat, different for different women. The actual tissues start to become less elastic. And the thing is that those changes occur gradually over the course of years. It's kind of like the aging process. It's a process that goes on and on and on, and it doesn't stop until the end. So, in the beginning, it's more shocking. And then after a while, you realize, oh, this is sort of my new body. And there's many things that can be done. For example, it used to be thought that bioidentical hormones were not healthy. They carried cardiac risks. Now that's been shown to be not true. Actually, they have many benefits. So it's worth looking into, talking to your gynecologist about this.
I'm glad to hear you bring up hormones, because that's part of the reason I started researching all this. I've got several books I've been reading, because that's what I had heard was like, ooh, be very afraid that hormone therapy will up your chance of breast cancer. And from all the stuff I've been reading, they're like, that was based on a flawed study, basically,
That's
from
right.
years ago, that they
That's
had
right.
older women in the study that had been gone, they were well through menopause, and a lot of them were not healthy to begin with. So it wasn't
That's exactly right. Yes, it wasn't a balanced, valid study. And the medical profession just sort of took it and ran. There was a lot of kind of fear mongering at that time. Yeah, and I think that's why it's so important for women to start talking about this, educating each other, not just going, don't take face value what your medical practitioner says. Just talk about it with them, question, educate yourself, because some medical practitioners are stuck in the past. Yeah, yeah.
So doing some research, talking to maybe multiple doctors, maybe a PT and a doctor and a naturopath, maybe you've got a crew of people helping you. And it could take several visits before you get questions answered and get the results that you want.
That's right. I think that's a really good point, because it can be a lot of information. So it's better to think that you're going to educate yourself over the course of a few years. And over that time, you read, you talk, you understand, you listen to your body. And this is not a crisis. The hormones change over time also. There's perimenopause. There's no rush to start hormones or anything like that. It's just a different way of looking at the change.
Things are changing. I'm going to observe my body. I'm going to be curious. I'm going to do some research. I'm going to talk to people instead of being fearful and anxious.
Mm-hmm. Talk to your girlfriends, your women friends that you're comfortable with. See what their experiences are. Start to share, and you'll be amazed at how once you open up that conversation, there's a lot to say. Yeah.
Now, can you look to, say, your mother or your aunties or your grandma to see, okay, my mom started menopause at this age. I can kind of guess that I might follow suit. Is there a hereditary?
Yes. It's very genetically controlled. Sure. Yeah, I think that my mother, I don't know about my grandmother, started her menopause late, and so did I at age 55. Yeah.
Because they say the average is like 50, 52-ish, between 50.
Mm-hmm. Yeah, but yeah. And then sort of like late 40s, a lot of women will go into perimenopause, which can last a number of years. And during that time, your hormones are changing, your body is changing, and you'll have a lot of the symptoms that are so bothersome, like hot flashes, cravings, and sort of replicating those changes that you had during puberty. You say, how is it possible that I'm going to these emotional swings, all of those things you can experience again. And then once,
I've already warned the boyfriend. I'm like, listen, you just need to assume that anything wacky going on, like just playing this on menopause. And so now he can flip the switch in his head. He's like, oh, she's being a little crazy. This must be some menopause stuff going on right now.
At least now we have perspective, not like when we're 13 or 12, it was hard to deal with. Now we can say, okay, yeah, I can see I'm a little bit going out there today. Yeah, I need some space.
And so you're in New York, and you see patients in your clinic, hands-on, and then you also do these type of Zoom meetings?
I do Zoom meetings. Yes, I do some sessions on Zoom, and I do see people in person in my office in Manhattan. One thing I've been doing a lot of recently is actual exercises that condition and tone the pelvic floor and relax it when it needs relaxing. They're wonderful exercises that help to actually move the pelvic bones in such a way that the pelvic floor muscle attachments are affected. And it's a great way of working with the pelvic floor in addition to hands-on techniques.
I love it. So some soft tissue work, and then let's get your brain and your body involved in doing some of these exercises to tighten and release under your brain's control.
There's things that can be done. I've taken a course at the Postural Restoration Institute and they specialize in the pelvis alignment and how to specifically activate certain muscles. Sorry about the motorcycle.
Listen, I'm glad you have such a nice day that you can be outdoors for this interview. What a treat.
Yes, it is actually. Yeah. So, what else can we say?
So postural restoration I've heard of them for the therapeutic exercise. I know that's a good group.
Yeah, they have a unique approach, I would say, to working with the pelvic floor muscles through put the body in a position where the muscle has to work. So sometimes the pelvic floor muscles are so nebulous, it's hard to tell. Am I doing this? Am I doing it at all? Am I doing it right? It can be hard to tell. And so it's good to have exercises that just kind of like you don't really have a choice. You push against the wall, it's going to happen.
I love it. And then the best way for people to get a hold of you, is it your website or email or call you on the phone?
They're actually all good. My website is finnphysicaltherapy.com, and you can leave a message there. I do respond to phone calls and email. So my email is dfinn, DFINNPT @gmail.com. And the phone number is 646-752-7990. And I do respond to texts. So texts are a good way to reach me as well.
Awesome.
Yeah.
All right. Is there anything else you want to share about you or women's health?
About me, I'm a lifelong New Yorker. I love New York, and I love the city. I love upstate New York, and I also have a practice upstate New York near New Paltz, where people can come and see me up there.
Oh, so you split your time in the city and in the country?
Mostly in the city, but I'm in New Paltz one day a week, and I have a practice there. So It's nice to be in the green countryside. So important.
Now we're shooting this video on September 12th. What was the vibe like in the city yesterday?
I was actually upstate yesterday. When I got back to the city last night, and I saw the lights shooting up into the sky from the Twin Towers, which I think is the most beautiful memorial. Yeah. So I think that there are some people that are having, wonderful different memorials. There was a memorial down at the 9/11 site itself. And then there's other people that are they're sort of like going about their business, and it's been, over 20 years. And some people they've sort of incorporated 9/11 into their life, and they're just going about their day. Yeah. For me, actually, it's my birthday.
Happy birthday.
So I was celebrating my birthday a little bit yesterday, and then I was looking at the light going up from the Twin Towers, and just, that was my little moment of memorial when I looked up to that. Yeah. Yeah.
Nice.
Yeah. How about by you?
Yeah, one of my ladies had her flag at half mast so I go to my clients' homes for some training, and then I do some classes on Zoom. And so that was the first thing in the morning that I saw, and I was like, oh, right. And I have a couple of relatives who have birthdays today and yesterday. So I called my little nephew, his birthday was yesterday.
Yeah.
That must be weird having that for your birthday.
It's been really strange. I'm used to it now. Yeah.
All right. It was my pleasure to visit with you. I loved hearing about what you've been up to. I appreciate you taking the time to chat with us about all things pelvic floor health. And I'll put this up on YouTube and plug your business and your website and put the link there.
Thank you so much. And it was really lovely to meet you. Yeah.
Thank you.
To meet you. Yeah. And I love your emails and the kind of practice you have. If you were in New York, I think I would go to you.
Well, we can visit virtually, the magic of Zoom.
That's true. Yeah.
All
right. Thank you.
Thank you, Ms. Deirdre. Have a good rest of your Tuesday.
Thank you. Okay, you as well.
Bye.